sleeve gastrectomy is a relatively new procedure, and we're just beginning to understand what life is like 5, 10, 15 years afterward. One thing that we are seeing, and that is absolutely worth knowing about if you're proceeding with a sleeve gastrectomy, is that there is a higher risk of weight regain compared to the gastric bypass. When I talk to patients about that, they often will say, well, why is this? What's going on? Is the sleeve stretching out? And the truth is, we don't really know exactly why people are regaining weight after surgery, but especially now that we're thinking about these surgeries as hormonally active treatments rather than some type of anatomical blockage or mechanical therapy, that we have to look at them like a medical therapy. It's almost as if we're giving you a medicine. That medicine happens to be surgical rearrangement of your GI tract, but we're giving you a medicine, and that medicine over time may have varying effects. The way the medicine affects you on day one may be very different than the way the medicine affects you at 5 or 10 years out. So what we know is that all medical treatments have a variable response. And when it comes to sleeve gastrectomies, we see significant variation in the amount of weight that you lose. And if, let's say, we're talking about a 300-pound patient, that we may see them at 1 year, at 5 years, or wherever we're evaluating them, we may see some patients here at the tail, and they may have lost only 50 pounds, or in some circumstances, even less. We have other patients here, and they're weighing 150 pounds. They've lost 150 pounds. So why is it that we have these huge variations? It's primarily genetic, which we'll talk about in some of the later videos. But there are other factors that we don't fully understand. It probably doesn't have that much to do with how the surgery was performed. But the sleeve has a variable response, meaning some people do amazingly well with a sleeve and other people really don't do well at all. And then there's people all the way in the middle. With a gastric bypass, we see a little narrower bell curve. We may still see these people at 150, but we really don't see those people who only lose 50 pounds after a gastric bypass. So we have a more predictable response, and that just is inherent to the nature of the therapy, looking at these procedures as driving hormonal shifts, not causing mechanical blockages or things like this. This is not something that we can look at like a joint replacement, which can wear out in a certain place. We have to look at this like a medicine, like something we're giving to change your body's physiology. What we also see is variable durability. We see some people lose weight and really keep it off, and it's not that hard, and this treatment works for a long time. We have other people who kind of start heading up even 2 years out from surgery. So another big difference between the sleeve and the gastric bypass is when we do see weight regain with a sleeve, we can see it as soon as 2 years out from surgery, where with a gastric bypass, we're usually more in the range of around 4 years. And I think this also speaks to something I've mentioned in some other videos, which is that weight regain after a gastric bypass, I find it's not always the case, but it's usually fair, meaning there was something that the patient did that was really not what they should have been doing. They either started drinking sugar-containing beverages. This really doesn't necessarily lie with the fault of the patient, but they were placed on a medication that causes a lot of weight gain. But there's some inciting factor that triggered the weight regain, whether it was dietary or non-compliance, or it was some medicine or other lifestyle or environmental factor. Something triggered that weight regain. With the sleeve gastrectomy, I don't always see that when I'm working with patients who are regaining weight after a sleeve. They may be doing everything right. They may be eating well. They may be exercising. It's just that their genetics and this surgery and the hormonal shift does not last forever, and we're starting to see some weight regain much sooner than we would like. And we know that there's a lot of variation in the durability of these procedures, where some people lose weight effortlessly and keep it off for the rest of their lives, and other people really struggle even as soon as 2 years to keep the scale just the same as where they are. So when we look at the statistics on weight regain, and they do what's called meta-analyses, which is where they go through the literature and find as many studies as they can that look at patients at 5 and 7 and 10 years out from surgery, and they try to combine all the information because the more people you have in a study, the better. So they try to combine all the information and make some assessments of what all the research shows. And they're useful studies to look at, especially for long-term follow-up, because oftentimes there's not a lot of patients in each one of the individual studies, especially at this point. When we look back 10 years, there just weren't a lot of patients who are having sleeves, and tracking people down is not always easy. So these studies can be very helpful, but the first thing we see, and this is a remarkable number, is 2/3 of patients will regain some weight, where they at 5 years out, they are significantly heavier than they were at their lowest point from surgery. And this number for a gastric bypass is more like 1/3, where 1/3 of patients at 5 years have started to regain some weight. So that's a pretty substantial difference. So the vast majority, and I think the natural history of sleeve gastrectomy is that there is some weight regain. Now, it doesn't mean you regain every pound. And when we look at these numbers, a sleeve gastrectomy is still way better than any type of nutritional numbers. If you could create a diet that had the same numbers that we see with the sleeve gastrectomy, it would be touted as the single best diet that has ever been created by 100, and nobody would ever debate dieting anymore, because that would be the diet that they would choose. So please, when we're looking at these numbers with the sleeves, it's and looking at the weight regain and saying that this is an issue, it's because we're comparing it to a gastric bypass, which is a better treatment for weight loss, but it also has these issues with long-term complications that we typically don't see with a sleeve gastrectomy. Another study, another measurement that's used for weight regain is having less than 50% excess weight loss. So in order to figure that out, the way you would determine is if we have someone who's 250 pounds and they lose weight and their ideal body weight, let's say, is 150 pounds, then we measure their excess weight as 100 pounds. It's essentially how much weight do you have to lose. And one of the things that's difficult about this is how do you determine what someone's ideal body weight is? Do we use a BMI of 25 and kind of back calculate from there? Do we use these life insurance tables, which are based on your height and have to do with adding 5 pounds for every inch and measurements like that? There's a couple of different ways to figure out ideal body weight. But in essence, 50% of your excess weight loss, if your excess weight is 100 pounds, would be 50 pounds. So that what that would say is if we had someone who's 250 pounds and their ideal body weight was 150 pounds, what would 28% of them would at 7 years out be more than 50 pounds above their ideal body weight, meaning that they would weigh 200 pounds. So 200 pounds would be a 50% excess weight loss, because you're 150 and that's 50 pounds, that's half of 100. So that's 200 pounds. So if we're taking someone in this scenario from 250, they should be 150. What are the chances at 7 years that they weigh more than 200 pounds? And it's 28%. That's a very specific example. If you follow the math, you can kind of calculate it by yourself. But essentially, 1 in 4 patients have lost less than half the amount of weight they should have lost at 7 years. So that still means 3 out of 4 patients have lost and maintained at least 50 pounds from that starting weight of 250 pounds. So I think that's a fairly good number, but it also shows that there's a substantial number of people who at 7 years out have regained some weight and really aren't kind of at that same level of surgical success that they would have hoped for going into the procedure. Another thing is that patients after a sleeve, starting around 5 years out, pretty much everyone will regain around 1% of their total body weight. So if you're at 200 pounds, 1% of that is 2 pounds per year, but then you multiply that by 10 years and you've got 20 pounds of weight regain. So there is this inevitable trend toward weight regain down the road, and this idea of 20 and 30 year weight maintenance at that lowest weight after a sleeve is really not what we're seeing. We're not seeing people regain all of their weight, and of course most people who have this surgery are gaining weight every year. So if we take someone who's 250 pounds at the time of surgery and we don't do surgery and we look at them 10 years down the road, they might be at 300 at that point. So there's a lot of issues when we're looking at this, but I think the net result is that when we look at a sleeve gastrectomy, that there is a significant risk of weight regain, and this really is, along with heartburn as the complication, weight regain is the real Achilles heel of a sleeve gastrectomy. We just don't know that this is going to offer all of the great long-term weight loss results that we would hope that it would. We also know that there's a reasonable amount of patients who then choose to undergo a second or revisional surgery, and we will have some videos that discuss revisional surgery. But we know that 16%, and this is going back, this is some of the early sleeve patients who had their procedure done in like 2005, 2008, somewhere in that range. So there may have been some improvements in technique, but we know that when we look back on those patients that there's a 16% rate who underwent another weight loss surgery. It was most commonly revision to a gastric bypass. And 13% of them did it for weight regain, and 3% did it for heartburn symptoms. So again, there's that subset of patients who have such severe heartburn that they have to revise it to a gastric bypass. I know that when I work with patients and who are struggling with their weight regain after a sleeve gastrectomy, we're talking about things like revision to a gastric bypass. There's often a blurred line between these heartburn symptoms and the weight regain, where we may be kind of using heartburn to help the insurance purposes because they may have some stipulations that prevent a secondary weight loss surgery. So they do have some heartburn symptoms, and they are significant, but would, in the absence of the weight regain, would they also have elected to have the surgery? Generally, no. It's really the two together, the idea of resolving the heartburn and the additional weight loss, that push them toward having a revisional procedure. So we know that there's a risk at 7 years that you're going to need some additional surgery in order to maintain your weight loss. And that's something I think every sleeve patient has to go in understanding. When we look at all the head-to-head studies about gastric bypass versus sleeve, at this point it really is not debatable. There are still a few fringe people out there who are trying to make claims that the sleeve and the gastric bypass offer the same weight loss, but when you review the science, the large outcome studies, and we've been doing a great job in bariatric surgery of tracking people's outcomes after surgery, that it is really not debatable that the gastric bypass offers better weight loss and better weight loss durability. And if you're choosing a sleeve, you must know that you are not choosing the best weight loss surgery. So that really brings us to this idea of nutrition and exercise. So if you say, well, I really don't want to have a gastric bypass, I understand that that's the best weight loss, I get it, but I still want to do it. So what responsibilities do you have in order to maximize your chances of success? And what I talk to every sleeve patient about is that your nutrition and your exercise must be amazing. It must be really, really, really good, way better than everyone else. And if you are a sleeve patient and you look around at a family meal and you're eating the same thing as everybody else, you better be very, very careful. It takes regular exercise, ideally high intensity or weight training exercise, and it takes a really great nutrition. I have my Caloratio app, which can measure how compliant you are with our program. We should be seeing numbers of 80% or higher, which are, if you use that app, you'll recognize you got to eat really, really well to get in that range. So we should be seeing near complete compliance with the nutritional program and a great exercise. And then I think you set yourself up for success. And we have seen that it's really more in mouse studies, but we have seen that diet really helps the sleeve gastrectomy patients lose more weight, more so than it helps the gastric bypass patients. So because of the hormonal shifts, there's, I think, a little more room for influence from nutritional changes and from exercise to drive weight loss after a sleeve, where a gastric bypass kind of maxes out all these factors, and we don't always see that same long-term advantage in terms of people's dietary compliance with a gastric bypass. So the bottom line is that the durability and the amount of weight loss after a sleeve gastrectomy is limited, and it is not as good of an option as a gastric bypass. However, the favorable long-term complication profile and the safety of the procedure still makes it a very viable and excellent choice for anyone who chooses to undergo weight loss surgery. However, if you are choosing a sleeve, you must recognize that good nutrition, great nutrition, and exercise is going to be a critical part of your success plan.